Hi, this is my video for our concept for week 3, which is on caring. So I figured I would just start off by reading the definition that I found in our student handbook and then kind of elaborate more from there. So we have listed that caring means promoting health, healing, and hope in response to the human condition. A culture of caring as a fundamental part of the nursing profession characterizes our concern and considerations for the whole person, our commitment to the common good, and our outreach to those who are vulnerable. All organizational activities are managed in a participative and person-centered way, demonstrating an ability to understand the needs of others and a commitment to act always in the best interest of all stakeholders. So, if you really sit with that for a little bit and think about what it truly means, you can kind of understand why caring has a deeper meaning than what you would think. Of course, all of us as nurses know it's our job to care for a patient. So whether that meaning getting their meds on time, just follow up education on discharge, making sure they're discharged appropriately to different facilities if they need to, or if they're able to go home. But caring really goes a lot deeper than that. And I think one of the first times I really realized like what it truly meant to care in a different type of way was my 4th semester of RN school was in COVID. So I was on the COVID ICU, and that time was very crazy. Nobody left the ICU. Like, we had patients, the same patients in the ICU for the entire semester. And I remember one time, it was the first code I had ever been a part of. We coded the same patient probably, multiple times. It was like at least every hour for like 5 hours before we were able to get a hold of a family member to see if we could change the code status. And I remember one of the nurses there, she was exhausted because she was working like crazy. And I remember one of the nurses just saying like, come on, like you can pull through, like, come on. And I didn't understand like what it really meant, like why. I knew why she wanted the patient to pull through, obviously, but I mean, she really cared, like it was affecting her, And I feel like when I witnessed that COVID ICU trauma, I was able to understand that once you really tap into that internal caring in nursing, you start becoming a better advocate for your patient, which leads to just better outcomes. I mean, if you think about it, like 90% of the time you are with the patient, you're their voice, like you're what they're seeing. You're the one in the room. You're relaying the information to the patient from the doctor. You're relaying the information from the patient to the doctor, and they rely on you for that help. And when you really tap into that caring and you start seeing things differently, and you really start pouring yourself into caring for these patients, your patients will notice, and so won't your other colleagues. Like when you start recommending different treatment types to a provider, like they're going to pick up on that, and they're going to notice like, hey, she's really taking an interest in my patient, or like she's got good ideas. And it's just reflective care, like you're pouring yourself into that patient. And I know it's difficult sometimes when you have multiple patients on the floor, or when you're in the clinic and you have 50 patients coming in and none of them no-showed and somebody called off. So now you're getting pulled from your job and you're having to do your job and help with someone else's job, and you're not getting back with the patient in time. And it's same when you're on the floor, like you're running around like crazy. You're doing your dressing changes, med passes, talking to families on the phone, talking to doctors, entering labs, looking at labs, doing assessments on 12 different patients, and you're busy and you're stressed. But I think if you just stay present in that moment, if you can just give each patient your undivided attention for as long as you're in that room, and just level with them and just say, hey, like, I understand what's going on. Like, I will take care of this. I'm a little busy right now, but I promise I will get back with you. And then when you follow up on getting back with them, the patient is so appreciative of what you just did. And even though it might be something really small, like, hey, I'll check back to see if I can switch your medication around. And 2 or 3 hours pass, and you finally make it back to the patient's room, and you're like, hey, I'm so sorry, but I did speak with the provider. I'm able to switch this medication around. And the patient is just so thankful to you in that moment. And it could be the smallest thing, but it's because in that moment you were compassionate and you were showing that you truly cared about the patient. You heard what they were saying, you recognized what they were feeling, and you were able to circle back around and do what you said you were going to do, which is care for the patient. So I think when you really just understand that caring for the patient, in an indirect sense of the word, really comes full circle with what caring for the patient actually means. Again, it will just make for better outcomes and a better experience for your patient.